the head of the humerus, the anatomical neck of the humerus. The surgical neck of the humerus is down here. And the last thing we want to look at is the deltoid tuberosity, which is about halfway down the bone on the lateral side. The glenohumeral joint is made when the head of the humerus articulates with the glenoid cavity of the scapula. So this is our glenoid cavity of the scapula. The first thing I want to talk about is the coracohumeral ligament. The coracohumeral ligament comes from the coracoid, comes across the joint capsule. So it is superficial or on top of the joint capsule and attaches to the humerus. The next ligament I want to talk about is the coracoacromial ligament. I'm going to come down to the hand. I'm going to take her hand like a handshake. This allows me to create a direct line of lateral compression. So if we think about the three ways that muscles can end up hypertonic, can get extra tone, one is of course by using their actions repetitively. The second is if one of the bones has moved into the space that that muscle inhabits. So it takes up the space of that muscle. So if the head of the humerus, say, moves anterior or medial, it's going to diminish the space in which anterior deltoid sits. That can create tension as well. The third way is a direct line of compression into the muscle. So if you have compression through the joints, you can create tension in the muscle without ever using the muscle's action. So we're going to use both the actions of the muscle and a direct line of compression to release the muscle. I'm going to monitor here on the anterior deltoid. Again, your monitor hand should feel a pulse or a heat release or energy movement. You're not monitoring too hard. This is a superficial muscle. I'm going to take my right hand, which is in her right hand, create a direct line of lateral compression. So we're coming straight up through the deltoid tuberosity. And then I'm going to create a little bit of medial rotation of the arm at the shoulder. And I'm just going to hold that. We hold our moves for 20 to 45 seconds. Now, some of you will feel a pulse almost immediately in your monitor hand. Others, that will take a little bit of time. You might feel again a heat release or some kind of energy movement. And you want to play with the dimensions of this. On certain people, they may need a little bit more medial rotation. Others may need a little bit more of a direct line of lateral compression. Never compress hard enough to move the shoulder toward the ear. If you see this movement, you went too far. You only want to bring the humerus into the glenohumeral joint. So again, you're only moving to within the first 10% of possible movement when you do this. We're going to come out of that, and again, we're going to go back to palpating. Now let's take a look at the joints of the rib cage. So coming from the posterior aspect, where the ribs come into the vertebrae, and each rib comes in between two vertebrae. So external intercostals originate from ribs 1 through 11 and insert on ribs 2 through 12. And their action is inspiration or inhalation. And one more time. External intercostals originate from ribs 1 through 11 and insert on ribs 2 through 12. Are the intercostal muscles tight? That's what I'm looking for. Is there even space between each two ribs? So here, as I come up, he has good space, and then all of a sudden, right here, not good space. Everything is compressed. So because the compression is here, either the top rib moved inferior or the bottom rib moved superior. So we need to determine which one of those is true. So I'm going to feel the space above, and I'm going to feel the space below. I would say the top rib has moved inferior. So that's what we're going to work with first, is we're going to take this rib. Remember that the ribs are curved. So follow that rib out along to the side of the body, to the lateral side of the body, and you're going to move that rib so that this portion of it moves inferior. So I'm actually moving this area here superior, using it like a fulcrum, like a teeter-totter. I'm monitoring with this finger. I can take that away. And after we release that, we'll go back, we'll check it again. Directly in the middle of the body, the pedicles, the transverse processes, the lamina, and the spinous process, we've created a hole. That hole is the vertebral foramen. Okay, so before we go to the medial side of the scapula, let's do one more release for traps, this time for lower traps. So I'm going to move around the body again, palpating along the medial side. And I like to do this move from the opposite side of the table. So from here, reach under the shoulder. Your objective is to bring the scapular spine toward T12. So to bring the scapular spine toward T12. So I'm going to reach under the shoulder, monitoring right in here. Lift slightly posterior, and then arc down toward T12. You can target this a little bit. You can come a little bit more inferior and get the lower fibers. You come a little less inferior. Make your arc come a little bit higher and get the upper fibers.
The second movement now forms the other half of a cross coming across the body. So that one came this way, and this one's going to come this way. So you form a cross right on top of the body. Start with the arm at the opposite shoulder, and you're going to bring it down to the same hip. Again, you're bending the elbow as you're taking it up and bringing it straight down. Supinating going up, pronating the hand coming down. Using your body mechanics to take it up and bring it back. Use your legs and back down. Steph's going to take it, place it between her hands. Let's do the overhead first. Bringing up above her head and stretching the cord apart. So she's at about 60 to 70 degrees at the shoulder. She's going to hold for 3 to 5 seconds and then relax it. And again, she's going to take it out, keeping the shoulders down. We want to try to reach back a little bit. There we go. And relax down and take it apart. Really pull these shoulder blades together. There we go. Nice. I'm holding for 3 to 5 and relax. And one more time, take it out. Pull this together in the back here and hold 2, 3 and relax. Take the arms down, give yourself a